In this video, I'll be performing a skin assessment and describing what exactly that means. Now, first, to inspect the skin, you'll be looking for anything that is not baseline or not normal for that client. You could be looking for a difference in temperature at a certain part of the body, any type of texture, whether that's dry, papery, calloused, any type of moisture that could be from abnormal sweat, leaking, a laceration inside any skin folds. You will also test the integrity of the skin. Has it blistered? Is there a strange pressure point, a tear? And also looking at the anatomical location, looking for any abnormalities. And lastly, you'll be looking for any color or pigmentation, whether that be blue, brown, etc., especially if that is in a distal area of the body. Now, when it comes to skin color appearances, red could indicate inflammation, a burn, allergy, infection of some sort. White can indicate decreased blood flow. Blue can as well. White can also indicate dryness. The blue skin will be that decreased blood flow, lack of oxygen to blood, or some sort of rare chemical exposure can also create a blue appearance. Lastly, purple can indicate bleeding or bruising due to a trauma around or below the skin, or can be associated with a hung or LART issue and be due to an obstruction in the heart or lung. Now I will be showing how you would test for edema using a tape measure. Now you'll be measuring the circumference to compare to this patient's baseline that you may already have, or you may be taking the baseline if the patient indicates any type of swelling or you notice something during your initial general skin assessment. So we would take the wrist here, and as you can see, I have already inspected this skin. There's no discoloration, wounds of any sort, or different textures, etc. You can test their circumference around the wrist if there were to be swelling, just like this, or you can use the tape measure to create a sort of figure 8, where you would place it starting below the wrist, around next to the pinky, across by the thumb, and down to meet the other end. Now here we are displaying about a 33 centimeter circumference. And you would compare that to baseline, like I said previously, or wait until the next time you saw the patient and compare that to see if the edema has gotten any better or worse.